So here's the deal. Last night I was squatting. I knew I needed to take a deload week. After work at around 9:30, I made my way to the gym. I was already feeling tired. I was already feeling a little bit hungry, and I already had like a sedentary weekend with a lot of traveling and sitting. But I still wanted to get some heavy squats in, and I still wanted to get the workout in, but my plan was to do half the volume but remain the weight. So I did my warm up and I did everything as I normally would. The one big difference I noticed now in retrospect is I went a little bit lower my squats than I normally do, and I carried that over through my working sets. So 135 felt good, 225 felt good. My first set of 315 felt great. I only did 3 reps because I wanted to do half the volume. Second set of 315, I was doing my squats. First rep felt great. Second rep at the bottom of my squat, I felt as if, likely not what actually happened, my back slipped like that, and I immediately had to drop the weight on the rack. So at that moment I knew I fucked up, and I was like, okay, so now I'm in this acute back pain. So I got up, pain hasn't set in yet, so I took the time to unrack the weights, and then surely within 5 minutes, it started to seize up in my low back, and I started to lose range of motion. And that's when I called my girlfriend and asked, do you mind picking me up for the gym? Because I don't think I'll be able to walk home. So sure enough, I gave myself acute mechanical low back pain. Now, what I was trying to think of is how am I going to use this as a good method to keep me on track of what I would tell myself in the situation, and also as a learning opportunity. So I'll walk you through the first 12 hours of what I did, and we'll just do kind of a video log up to date just to really paint the picture of what you should kind of like expect from someone with acute mechanical low back pain. Now, first things first, it was very mechanical in nature. I heard it squatting. Now, I have a few really good things in my favor. First of all, I know what to expect and I know the healing timeline, so I'm not worried, I'm not stressed about what happened. I am pissed off though, because it's a huge pain in my ass. The second thing is I have no neurological symptoms. So I have no numbness or tingling, no pins and needles. I don't have what we were worried about with quada, kind of with like loss of control, bowel or bladder function. I have no pain referral into the buttocks, down the back of the leg, down the leg at all. So all of those are really good. So those red flags I'm not worried about. So I'm really dealing with just the mechanical pain right across the center of the low back. So I'm really thankful for that, because that shows there's no lumbar radiculopathy, no massive disc bulge or something that could be causing that nerve pain. That's going to be a huge, pain management thing. So those are good things. So where am I at today? So last night when I got home, I immediately took 400 milligrams of Advil just to help control the inflammation and give myself a chance to like have a little bit of movement and comfort. It did help quite a bit, so that's also a positive thing that the painkillers were able to help take some of the pain away. And then I just laid on a heating pad on my back as best as I could, and then I was actually able to sleep pretty okay. I did move a lot more than normal, but I slept both sides. Right side was better for whatever reason, and slept a little bit on my back. So that was all good. Waking up in the morning was pretty terrible, as the pain meds were obviously all worn off at that point. Trying to sit on the toilet for the first part of the morning without any Advil was excruciating. So I had to get off, take some Advil before I get some freedom. So everything I'm about to show you now, I'm on like 400 milligrams of Advil, roughly an hour and a half into the morning already. So I'm feeling much better than I was this morning. So what are my limitations right now? This is as far as I can bend forward medicated at the spine. So right there, and I'm starting to feel that pulling into my low back. So that's as far as I can bend forward. My hinge, this is as far as I can hinge right now. Right to there, before I start to feel the low back, a lot into the hamstrings. Side bending is actually pretty okay. Rotating is pretty okay as well. Bending backwards, that's as best as I can do without getting that kind of deeper pain. Again, this is all medicated. I can squat right about to almost parallel, but the best thing is I can reverse lunge. So as long as I stay upright, I can reverse lunge. I can't reach forward very far without getting some of that pain in the mid back. Again, this is all medicated, so this is like, I'm trying to be mindful of myself here. So I do have limitations. I just tried walking for a bit. I was able to tolerate like a 10-minute slow walk without raising up any pain, so which is good. So 12 hours post, what I know about that is I'm still really early in the acute inflammation stage. For whatever injury occurs, I know that it's going to be acutely inflamed up, 3 to 5, maybe even 7 days. So I'm kind of anticipating the next 3 days are going to be kind of shitty, and they're going to be the worst of it all, just as everything's inflamed and it's going to, before it starts settling down. So what I'm going to do is I'm just going to kind of figure out what movements I'm able to still do, just to kind of keep as much normal activity and normal exercise without exacerbating my symptoms. So for example, I was able to do a pull-up, so I'm going to, tomorrow I'll try doing some pull-ups. Today I'm going to try and see what kind of my shoulder rehab stuff I can do. Just to work on my shoulder things, see if I can do some push-ups. I'm just going to see what I can do that doesn't increase any pain, and I'm going to do those things. I'm not going to be forcing the back to be moving and bending as much in the first few days. I just want it to kind of settle down. Also, I'm just going to try and, like, whenever I'm sitting or standing, really relax the glutes. I don't want everything to tighten and garden up, because I want to have everything like at that normal resting tone. So I'm going to try and prevent that muscle tightening and seizing, because I can already feel that it's getting tight. I'm also going to use the heat pack, so I'm going to go sit on the heat pack for a bit after this video. And then the worst thing is I'm going to try to work today. So luckily I don't work for another 2.5 hours, but that's going to be difficult because I know I'm going to need some meds, and I know it's going to force me to be bending forward when I'm assessing people. Luckily I looked at my day, mostly just some shoulders and knees and ankles, so I should be able to go through that pretty okay, but if I can't, I'll have to make that call. That would be one of the things against my advice. I'd be usually advising people, you should probably take the first 24 to 48 hours off of work. And this is where it's tough, where it's hard to objectively treat yourself. Luckily, my partner's also a physio, so I was able to just kind of double check in and ask a few things just to reaffirm myself, because it's really hard to be objective with yourself, because the pain experience can really cloud your judgment and cloud your thinking. And really this vlog is just going to help me stay as objective as possible. So what do I got going for me? I have no neurological symptoms, which is excellent. Pain medication is helping, and I was able to sleep last night. Huge factors that are going to help my recovery. What I got working against me is I do have significantly limited lumbar range of motion, particularly with flexion and extension. I do have constant pain and discomfort in the lower back, but it's low grade with medications. And then I have a little bit of that stress of, still having to go to work and things. So those are going to kind of work a little bit against me, but all going to be improvement, as I know the healing timelines are within that first, 3 days are going to be the worst, and then they're going to start getting better. So my focus for today is just going to continue to control symptoms, and I'm going to try and bring in some exercises for my shoulders and my chest that I can still do, that I would normally try to do on my push day, just to keep things as normal as possible. And I'm going to try to go for a little bit of a walk later too. And this will all still be doing with some medication, some Advil, 400 milligrams, but I'm going to try and remember that it is masking some of the pain or some of the symptoms. So I'm going to try and be extra cautious in that green light zone. So I'm not going to push into any discomfort for anything, because I know that if I wasn't medicated, there would likely be some discomfort. So that's my plan. This is the first 24 hours, or first 12 hours actually. Super sucks, really pissed. I should have known better. I should have looked for the signs of being extra fatigued, reading myself that this week I was going to plan to take a deload week, being hungry, having a sedentary weekend, and I just did my squats a little bit deeper than normal, I think, and then, it's the bucket. These things happen. So we'll see. We're going to keep vlogging, and we'll see how it progresses over time.